Dear colleagues, my name is Philippova, and I would like to present you the results of our small pilot research, how Botox can change urinary microbiome in patients with neurogenic bladder. Philippova, Bazhenov, Ziryanov, Ural State Medical University, Yekaterinburg, Russia. Authors have nothing to disclose. As you know, urinary tract infections are one of the most common problems in patients with neurogenic low urinary tract dysfunction. Reorganization of urinary microbiome in neurogenic bladder plays an important role in UTIs. However, we still don't know how the different types of therapy, particularly botulinum toxin injections, change the microbiome. The aim was to assess the urinary microbiome in neurogenic bladder patients with high recurrence of UTIs before and after botulinum toxin therapy using gene sequencing and metaproteomics. Following written consent, urine samples were obtained from 6 patients, 2 males and 4 females with neurogenic low urinary tract dysfunction due to spina bifida or spinal cord injury before intradetrusor botulinum toxin injections and 6 weeks after. Recruited patients had neurogenic bladder for many years, performing intermittent catheterization and suffering from often exacerbations of UTIs. Patients have undergone an urodynamic study using Triton machine by Laborie with air-charged catheters. The presence of high-pressure Detrusor overactivity had been proven in all patients. Previous therapy with anticholinergics had no effect. Injections of 200 units of onabotulinum toxin A were performed in operation room under intravenous anesthesia directly in the detrusor in 20 points. Urine samples were investigated using standard urinalysis, enhanced quantitative urine culture method, and 16S rRNA gene sequencing. All patients had a clinical and urodynamic improvement confirmed by increasing of a bladder systematic capacity by 187 milliliter, bladder volume and the time of first involuntary detrusor contraction by 285 milliliter, and decreasing of maximal detrusor pressure during involuntary detrusor contraction by 35 cm H2O. The clinical follow-up for 6 months after botulinum toxin injections showed that in all cases frequency of UTIs has decreased. Male patients had no UTIs for half a year. 2 women with positive changes in microbiome also had no UTIs, and 1 girl had 1 episode of UTI. Female patients with abnormal microflora had 2 episodes, maximal count of UTIs among all patients. The results of the urine culture correlated with 16S RNA sequencing results, but the greater amount of bacterial toxins were detected by metagenomic sequencing. Analysis of the bacterial community in urine samples revealed between 2 and 21 species level reads per individual. All patients before botulinum therapy demonstrated abnormal urinary microbiome with predominance of Enterobacterales. Female patients were more likely to have predominantly lactobacillus in urine after Botox injection than before. In 3 cases, in females, microbiome had been changed after therapy from Enterobacteriaceae to Lactobacillus. In 1 female and 2 males, no principal changes had happened. The study showed that in females, improving in urodynamic parameters after botulinum toxin therapy may be associated with changing in the urine microbiome towards a normal flora. It expands our understanding of the UTI's development in patients with neurogenic bladder and the protective effect of the botulinum toxin therapy. So this is the first report comparing in pilot study the urine microbiome in neurogenic bladder patients before and after Botox injections into the bladder wall. The results are restricted by the small number of participants because of the high cost of 16S rRNA sequencing. However, the promising observation about the influence of botulinum toxin therapy on urinary microbiome was obtained. Thank you for watching.